Every day we get new patients, and they come in with their labs from their other doctor, and they may be telling me, I'm here, John, to see you because I have no energy. And they tell me, my other doctor, here's all the labs, everything's normal. And for years, I used to agree with them. Sodium 135 to 145 is the range. If they're at 135, 136, they're fine. Until a number of years ago, I had a patient come in, and this guy always complaining of just feeling bad. And I would look at those labs and they're just fine. And one day he said, when he was growing up on a farm in Nebraska, he loved salt. In fact, the salt licks that they had for the animals, he would lick them, finding the deer for the salt. And he just loves salt, ate salt all the time. So I looked at his lab, and his sodium level was 140, right in the mid-range. And in our office, we can do IVs, and I gave him an IV of normal saline. And he wasn't feeling really good that day. At the end of that IV, he says, John, I feel great. I checked his level. His sodium was about 147, 148. And what I started to realize is most of these labs, there's a range. And what we think is if you're 1 point within the normal range, you're fine. That is not true. My job as a doctor is to find out where on that range, where on that bell curve does my patient work best. And I'm just saying, like for sodium, more and more of my patients work better when their salt is at the higher range. I think thyroid is another thing. Free T3 is the normal range for a thyroid, free T3. That's the actual thyroid hormone. And the range is about 2.0 to 4.2. And I had recently, the other day, a patient said, yeah, my doctor said I'm fine. And their range was 2.3. But they still had terrible afternoon fatigue, hair still falling out, gaining weight, feeling terrible. Their doctor's telling them they're fine, it's not the thyroid. I raised their thyroid level, got the free T3 up to around 3.8. And all of a sudden, the hair's coming back. Forget the afternoon naps. They have plenty of energy. I'm starting to lose weight. The metabolism is increasing. And it all comes back to realizing that with these labs, you have to think of it as a bell curve. Where on that bell curve does that patient work best? And that has just made a huge difference in my practice. And so next time you're dealing with your doctor, and when he says everything is fine, you need to have him explain that. Because you need to ask him, how do you know on that bell curve where I work best? I have patients with vitamin D. The range is 30 to 100. And they come in and they're 31. The doctor says they're fine. I will give them a shot of vitamin D. 9 times out of 10, they're saying, John, my energy is unbelievable. Because if you don't have enough vitamin D in your body, you cannot make the mitochondria work to make energy. If it's at 30, you're not going to get rickets. You need it over at least 60 just for cancer protection. And a lot of my patients, I run them 150, 200, and their immune system is unbelievably good. So just because you're a point into normal range means nothing. Don't let your doctor say, hey, you're fine. If you're not feeling right, something's going on, you need to ask him, where on that bell curve do I fit? Maybe I need more of whatever it is, more of an electrolyte, more of that medication for thyroid or whatever to feel better. Remember, we're not all alike. Where on that bell curve do you fit?